Pacemakers, Advanced Nursing Practice 5 Marks Introduction. Pacemakers are the electrode devices that can be used to initiate the heartbeat when the heart's intrinsic electrical system cannot effectively generate a rate adequate to support cardiac output. Currently available permanent pacemakers contain a pulse generator and one or more pacing leads simultaneously. Further innovations in the pulse generator and its circuitry extended the utility of the percutaneous technique even in the very young patients. Definition: pacemaker is an electronic device used to pace the heart when the normal conduction pathway is damaged or diseased. A pacemaker is a battery-operated generator that initiates and controls electrical stimulation of the heart via an electrode that is usually in direct contact with the myocardium. A pacemaker is an electronic device that provides electrical signals to stimulate the heart muscle. Pacemaker is an electronic device used to pace the heart when the normal conduction pathway is damaged or diseased. Components of pacemaker: pacemaker components combined with body tissue to form a complete circuit. Pulse generator, power source or battery that provides the energy for sending electrical impulses to the heart. Pacemaker electrodes, pacing lead or wires. Healthy myocardium: cathode, negative electrode, anode, positive electrode. Body tissue: function of pacemaker: pacing function, sensing function, capture function. Pacing function: it is the ability of the pacemaker to stimulate either the atrium and ventricle or both chambers in sequence and initiate electrical depopularization and cardiac contraction. Atrial pacing, ventricular pacing, atrioventricular pacing. Sensing function: cardiac pacemaker have the ability to see intrinsic cardiac activity when it occurs. Capture function: the ability to generate a response from the heart contraction after electrical stimulation is referred as capture. Working of pacemaker: a pacemaker consists of a battery, a computerized generator, wires with sensors at their tips called electrodes, the battery power of the generator, and both are surrounded by a thin metal box. The wires connect the generator to the heart. A pacemaker helps monitor and control the heartbeat. The electrodes detect heart's electrical activity and send data through the wires to the computer in the generator. If heart rhythm is abnormal, the computer will direct the generator to send electrical pulses to the heart. The pulses travel through the wires to reach the heart. Types of pacemaker/pacing methods: 1. Permanent pacemaker. 2. Temporary pacemaker. Permanent pacemaker. In an operating room, the pulse generator, a small hermetically sealed lithium battery weighing from 30 to 130 gram, is placed into a small tunnel burrowed within the subcutaneous tissue below the right clavicle. The pacing electrode is inserted through a transvenous route, most common, or directly applied to the epicardial surface by thoracotomy. Implanted totally in the body. Power source is implanted subcutaneously, usually over the pectoral muscle on the patient non-dominant side. Type